Hi CUT Dental Assisting students, welcome back to this week's lectures. I will be lecturing you again. My name is Dr. Tumi Mahlangu, or just Dr. Tumi. Thank you so much for having me again. This week we will be delving into prosthodontics, okay? So prosthodontics is basically the branch of dentistry that deals with replacing missing or lost teeth, as well as its underlying structures with artificial material or a prosthesis, as we might call it. So basically prosthodontics has two subsections, that is fixed prosthodontics as well as removable prosthodontics. But this lecture specifically, we will be delving into removable prosthodontics or removable prosthesis. So basically, removable prosthesis. Oh wait, before I carry on, please follow by downloading learning unit number 11 on eTudo. So this is the presentation that we'll be using to get through this particular lecture. And then please make use of the objectives, the practical skills, as well as the learning outcomes that are there to help you study. Yes, so use them, as if you know them, you should be fine with your tests and exams. Okay, so all these objectives and learning outcomes, they're very important, so please go through them and make use of them so that they can help you study for this particular part of the work. Okay, so I won't go through the objectives. Like I said, this presentation is on eTudo. Okay, so this will be removable prosthetics, like I mentioned before. I won't go into the objectives. You can read them for yourself, as well as the practical skills, those you will be doing in the lab practically, as it says. Okay, and then yes, so like I mentioned before, they're basically saying removable prosthodontics is a specialty of dentistry that replaces missing teeth with a removable prosthesis. So we're not only replacing teeth, we're also replacing its underlying supporting tissue that we may have lost when you actually extracted a tooth or lost a tooth in an accident or an injury or a medical condition. Okay, so removable partial dentures. So with removable prosthesis, we have two types of removable prosthesis. So it's the removable partial denture as well as the removable full denture. So please know the difference. So with the removable partial denture, we are replacing some teeth that you have lost either within a quadrant or in your arc, be it the maxillary arc or the mandibular arc, or it may just be a combo of both if you've lost some teeth in your maxilla and some teeth in your mandible. Okay, and then with the removable full denture, you're basically replacing all of the teeth that we have lost in that particular arc. So this would be a patient who maybe has all of their teeth are severely caries, so now they have to all be extracted and they cannot be saved, so they all have to be extracted and then replaced with something. So that would be a removable full denture. So that would be a denture to replace all the teeth in the arc. I need to just give you guys a heads up, what you are studying right now and private practice works a little bit different, but I'm going to teach you by the book. When you get to your respective practices, they will show you like where things deviate a bit. Okay, so here's some examples of removable partial dentures in both your maxilla as well as in the mandible that you can see in your slides. And then from there, okay, there's just a picture of your removable full prosthesis. So that is the full denture where someone has lost all of their teeth. Oh, and the one thing that I just want to let you guys know, normally in private practice, when we replace teeth, you know how every quadrant normally has 8 teeth. So 1 1 2 1 8, 2 1 2 8, 3 1 2 3 8, 4 1 2 4 8. Normally when it comes to removable prosthesis or prosthetics in here, we tend to not try to replace the maxillary and mandibular third molars, because they cause quite a complication with occlusion. That was my whole point of telling you about the whole private practice thing. So normally it's hardly ever where you find yourself replacing the third molar. So we try to replace all of the teeth up to the second molar. I just thought you should know that out of interest sake. So here are some extraoral factors influencing the choice of removable prosthesis. So firstly, they made mention of physical health. So physical health in terms of medical conditions, for example. I'll give you an example of patients with epilepsy. You would not necessarily put a removable prosthesis in a patient with epilepsy, because you need to keep at the back of your mind that they're prone to epileptic attacks. So now imagine if now they're busy having a seizure and then they have something removable in their mouths. It can actually get to their throat and choke them and actually die because of their denture. So such patients are examples of patients you would not place with a removable prosthesis, for an example. And then mental health, like patients who suffer from mental disorders such as paranoid schizophrenia, for example, they might start thinking that, oh, the denture's like demonic, yeah, like all these funny stories, and then they'll just constantly be breaking their denture, having funny thoughts about their dentures. Or yeah, if they don't have their full mental faculties, it would not be advisable to put a removable prosthesis in their mouth. And then with motivation, obviously, when a patient is in chair, you as the dental assistant as well as the dentist, because we're both going to be having conversations with the patient, we take that time to sort of suss the patient out. Like, is this patient motivated? Do they see the need to have the prosthesis in their mouth? How do they carry themselves? You can even check intraorally with how they take care of their mouth. That's normally a good indicator of whether they will be able to maintain and take care of this prosthesis or not. So normally with patients that have bad oral hygiene, they're not very motivated. You have to basically drill the importance of having a removable prosthesis in their mouth, or they're not very cooperative. Those are not patients who will most likely be successful with this treatment protocol. Okay. And then there comes the issue of age. Age normally would be like patients who are like extremely old. Thing is, you can start putting removable prosthesis in kids from like 6 or 7, and okay, I'll deal with that a bit later, and all the way up to, you know, the elderly in our old age homes and stuff. But if the patient is still at an age where they can still function and they can still are able to recognize like their surrounding environment and take care of a removable prosthesis, then obviously that would be a patient that you would give this prosthesis to. And then with dietary habits, I know in private practice, for example, patients, you give them a removable prosthesis, be it removable or the full denture. Some, for example, like the denture is constantly breaking because of their dietary habits. They like eating bones, they like eating like hard stuff such as apples. They don't cut down into smaller pieces. To stop eating bones, you know, minimize sugar and things to that effect. Okay, so those are the things we need to relate to the patient. So now if someone is not cooperating in terms of dietary habits and dietary factors, then we may have to look into doing something fixed, especially if they keep breaking their denture for who knows how many reasons. Yeah. Factors, basically finances. Okay, so the advantage of removable prosthesis is it's quite inexpensive relative to the fixed one, and it's easy to repair. So if it breaks, it's easy to repair, and it doesn't really cost so much money for the lab to repair it in case it gets damaged. So normally I know it's about 600 rand currently, but yeah, it's quite inexpensive relative to all the more fixed solutions. Okay, and then with occupation, obviously it would be what you do for a living. So obviously, like people like sales people that work in health, like you're talking to people, you're communicating with people, that would then be a removable prosthesis would be ideal, because the aesthetics become important. We need to smile, we need to be great, we need to look presentable. Okay, so yes, occupation does play a role, because normally like others who work in like labs and mines, they're not really that too concerned with their aesthetics, so others would be less likely to want a denture. But you as the healthcare professional, it's very important that you give them the reasons, and you show the reasons, and you relay the reasons why they need removable prosthesis. And then with the intraoral factors that influence the choice of removable prosthesis, your slides talk about musculature. So if the patient, especially with our geriatric patients, our old patients, the muscles tend to get flaccid with time, they tend to atrophy, so it will affect their ability to keep the denture in their oral cavity. Okay, then with salivary flow, obviously people who have less salivary flow, at a molecular level, guys, saliva has an important role in keeping the denture in the patient's mouth, ne? Yeah, chemically, I don't want to get into that story, but point is, ne, if the patient has poor salivary flow, they're going to struggle to retain the denture in their mouth. It's also going to affect their other existing structures or teeth by having them more carious, and so the areas that the denture covers will be more prone to oral conditions such as oral candidiasis as well as dental caries, because the salivary flow is not enough that can prevent or work in facilitating that medicinal purpose. Yes, that's what I wanted, medicinal purpose. Okay, so obviously then if someone has a high salivary flow, hey, great, -1. But then people like a poor salivary flow, then we'd have to then go back to the drawing board in terms of eliminating some foods from their diets. We'll have to maybe advise them to use mouthwashes, use sugar-free chewing gum, just to help stimulate the saliva so that the prosthesis can stay in their mouth, and then as well eliminating all the bacteria that is in their mouth that may cause disease. Ne? And then from there would be the residual alveolar ridge. This is important, guys. The residual alveolar ridge is basically the bone in the maxilla or the mandible after we've extracted a tooth. Okay, you will not call it a residual alveolar ridge if there's still a tooth in that particular area. So where a tooth has been lost, that underlying bone is known as a residual alveolar ridge. So this is very important, especially in the mandible, because if a patient has sat for a long time without a prosthesis, so they've removed teeth and have done nothing to replace those teeth in their oral cavity, then the body, or if I can say bone, works in a use it or lose it function. So if the patient did not replace their natural teeth with the prosthesis in time, the bone is going to get thinner and thinner and lesser, if I can put it that way, lesser and lesser and lesser over time. So meaning you have less bone onto which you can place this denture, because there's really not much especially in the mandible, that keeps the denture in place, especially if the patient is completely edentulous. Ne? So obviously if now the patient has severe bone loss and there's practically no residual alveolar ridge and they are looking for a denture, we may not be able to do a removable prosthesis. We may have to, for example, go with surgical interventions like replacing that bone first, allowing it to heal, and then placing a denture once we've replaced the bone that the patient has lost. So those are some of the factors that we talk about when we decide on the type of prosthesis that we're going to put in the patient's mouth. Then from there, we're talking about oral habits. So like we're saying, like we mentioned before, like patients who are not that motivated, who don't like cleaning, who do not like maintaining their oral cavity, those are the things that then would influence like what's our option A or B. But normally with removables, you can get away with a patient who's less compliant. The problem is with then fixed, because it's literally fixed to your mouth. So if the patient is not cooperating, then they're going to have dental repercussions. They're going to have oral repercussions such as disease in their mouth. So that's when then, for example, we would be choosing a removable denture as opposed to a fixed one. And then from there they talk about tori. So tori are bony protuberances in the oral cavity. So if a patient has tori, for example, it will affect the denture in that if the denture, for example, comes back, we may have to trim the acrylic in the region of the tori so that it does not like hurt the patient. Or we might have to change the type of denture, maybe go for like an over denture or something more fixed that we can maybe work around these bony protuberances, because if they have them, getting that denture in and out is going to be extremely painful for the patient. But in cases where the tori is not that protruded, for lack of a better word, then you can get away with it, but not always. They even go as far as affecting how the denture seats in the oral cavity. That's when we'll have to maybe go with options like with new technology such as flexible dentures that actually work around what you have in the oral cavity so that the patient is not so uncomfortable when they are actually at home.